such infection and which wound at risk for development of this infection. نبدي بالتيام الأول يمكن كده سمعتم بينه هو البويل، أوكي، أو فرانكل. يمكن تعرفون البويل مثل ما تشوفون بهاي الصورة. It's an infection of the hair follicle. Okay. Usually, as we know, the normal habitat of skin هو staph species. So, boil most commonly caused by Staph aureus microorganism. It's presented as a painful red swollen area, as seen in this picture, with a bit of pus. Okay. The most common site of involvement هي عادة تصير بالhairy area، مكان بيها excess hair, sorry, like face in male, neck and axilla, and in the pubic region. A chronic boil formation should make us think about an immunocompromised patient. يعني يجيك مريض كل كم يوم تطلع له وحدة boil، تخلي ببالك الاميونو suppression، فتشيك لا يكون البيشنت diabetic or AIDS. So chronic furunculosis is commonly seen in immunocompromised patients. شو الفرق بين البويل أو الفرنكل وبين الكاربنكل؟ شوفوا الفرنكل هي infection of hair follicle. الكاربنكل هو multiple boil one near each other connected between under the skin by narrow tunnels. So carbuncle is a combination of multiple boil مثل ما تشوفون بهاي الصورة، high single high multiple. So presented as a red swollen and painful cluster of boil that are connected to each other under the skin. The same caused of microorganism, which is Staph aureus. Again, it's mostly commonly occur in the hairy area, like in the face and axilla. It differs from boil that it will heal, leaving a scar, unlike boil. واضح؟ The third term is erysipelas. It's a bacterial infection of the upper dermis and may extend to the underlying lymphatic system. It is usually caused by group B beta hemolytic, group A hemolytic streptococcus, and may follow a minute scratch of the skin. Clinically, as seen in this picture, it's characterized by a well-demarcated area of injury, redness, and hotness. Sometimes the skin is less hairy. The site of predilection is usually the face, hands, legs, and feet. طبعا الباثولوجي يشبه السيولايتس but it's superficial. يعني erysipelas as if we are dealing with a superficial cellulitis. It may cause complication like erysipelas of the face, especially the nose, may cause cavernous venous thrombosis. مثل ما قلنا erysipelas may extend to the underlying lymphatic, so it may cause fibrosis and obstruction of lymphatics, which finally result in elephantiasis of the affected limbs. And finally, it may cause septicemia and toxicity. Hidradenitis suppurativa. The other name is acne inversa. هذا التيام ما مثل الباقي، هذا الباثولوجي هوني not caused by specific microorganism. So it's a non-infectious long-term skin disease characterized by the development of an inflamed and swollen lump, which may discharge fluid or pus. The most common site of predilection is usually under the breast and on the axilla. Again here شوف مثل ما تشوفون اكو scar from the previous hidradenitis. فالهيلينج يترك لنا scar. The underlying mechanism of development of acne inversa احنا قلنا not infectious. فالmechanism is due to a dysfunction in the apocrine sweaty gland or in the hair follicle function. نجي على acute specific localized infection واللي هي very important واللي هي very dangerous. The first of them is gas gangrene, the second هي tetanus, and the third is necrotizing fasciitis. Three dangerous infection. The first is gas gangrene. It's also known as Clostridial myonecrosis. It's a bacterial infection that produces a gas within the gangrenous tissue. And usually the cause of microorganism is a Clostridial perfringens species. It's a dangerous sort of infection with a mortality may reach up to 70%. Which wounds are susceptible to such sort of infection? First of all, deep penetrating wound contaminated by feces or by dirty and driven clothes after trauma. Lacerated wound with foreign body or devitalized tissue in immunocompromised patients. Limb amputation for peripheral artery disease with an open necrotic ulcer in elderly diabetic uncontrolled diabetes. Wound after colorectal operation or traumatic grossly contaminated war injury, and aseptic abortion. These are the situations that are susceptible to the development of gas gangrene. Really, gas gangrene having a short incubation period, it will present it clinically after 1 to 2 days from the onset of insult. Locally, مثل ما قلنا, within 6 hours to 3 days after injury, it presented with severe local wound pain and crepitus due to the presence of gas under the skin and in the muscle. The wound starts to produce a thin, sweaty brown, smelling exudate. The affected tissues show a tense edema with spreading gangrene. The color of skin and muscle will start to change in a sequence, starting with a brick red to a khaki due to hemolysis, then dark green, and finally black mottled, with a multiple blips and foul smell dark fluid discharge. مثل ما تشوفون بالصورة مؤشر على هذا الديسشارج. Generally, the patient toxic but afebrile and is in a confusion state with a delirious and rapid deterioration of conscious level. In advanced condition, the patient will present with circulatory collapse and finally multiple organ failure. We can diagnose this sort of infection depending on a clinical examination مثل ما قلنا inspection of the wound, نمشي على الكلر مال wound, sort of discharge, والكريبيتاس اللي تنحسب بالاكزامينيشن. الاكس-راي confirm the presence of gas in the subcutaneous tissue, and the final definite confirmation of diagnosis is by a swab, which revealing a gram-positive rods. In the Clostridia species, it's a gram-positive. Regarding treatment, we should give a prophylaxis against the development of gas gangrene in the susceptible wound. مثل ما حكينا قبل شوية, a wound at risk. To avoid the development of gas gangrene, we should do a prophylaxis for such a wounds. So, wound excision with delayed primary suturing, not primary suturing, with a coverage of a proper antibiotic, before limb amputation for peripheral artery disease with open necrotic ulcer in an elderly patient with uncontrolled diabetes. In a case of established gas gangrene, the treatment as follows. First of all, fluid resuscitation and should be given under monitoring in the intensive care unit. Aggressive debridement of dead or dying tissue, and sometimes we may need even limb amputation. High dose of intravenous penicillin G with flagyl and a hyperbaric oxygen chamber. يمكن شفتموه. A special chamber with hyperbaric oxygen هذا important for healing. The second type of acute specific infection is tetanus. Again, it's a dangerous and severe sort of infection. It's a bacterial infection usually causing muscle spasm, and this spasm is due to the effect of a neurotoxin, which is also called tetanospasmin. And this neurotoxin is usually excreted by Clostridium tetani bacteria, which is the responsible microorganism for tetanus. The mode of infection usually is due to implantation of this microorganism into the tissue or wound, and sometimes this implantation is trivial or undiscovered or even forgotten. يعني تعرض إلى تشكة أو خدش أو شيء وما عار له أهمية، خلال يوم يومين يبلش عنده السبازم. Which wound at risk of tetanus? A wound with a duration of more than 6 hours and it is deep and dirty wound with contamination by fecal material or soil. A wound with a devitalized tissue, foreign body or pyogenic organism as in military wound. Untidy wound like rash wound, electrical injury, frostbite, denervated or ischemic wound, animal or human bites, and burn. يجي تسمعون بمصطلح tetanus neonatal. It is the same sort of infection, but the route of entrance of microorganism is through the umbilical stump due to an clamping by an unsterilized instrument. الروت يختلف عندنا هوني. Clinically, the incubation period is lasts longer than gas gangrene, which may reach up to 1 month with a mean of 14 days. البرودرومال period، بتسمعون البرودرومال period يعني هاي البيريد between the first onset أو first symptoms till the development of spasm. And if the period is within the first 2 days، يعني أول ما بلش عندنا السيمتومز بعدين صار spasm within 2 days، هاي goes with bad prognosis. لكن إذا كان more than 4 to 5 weeks يلا بدأ عندنا spasm هوني usually associated with better prognosis. In the most common type, the spasm begin in the jaw, then progress to the rest of the body. Each spasm lasts for a few minutes, and it will occur frequently in the first 3 to 4 weeks. Some spasm may be severe enough to cause a fracture. مثل ما تشوفون هوني هذا البوستر وهذا البوستر very severe, for some time you're in a fracture. The other symptoms اللي حكيناها تبدي first symptoms بعدين يصير عندنا reflex spasm. The other symptoms may be fever, sweating, headache, dysphagia, high blood pressure, and tachycardia. Usually the recovery from tetanus take a time for it may be for several months. We can diagnose tetanus depending on the clinical examination and confirmed by isolation of bacteria from the involved wound. Regarding treatment of mild cases, it's achieved by administration of tetanus immunoglobulin, which is also we call it tetanus antitoxin. It can be given either through intravenous or intramuscular route. Metronidazole intravenously for 10 days, diazepam oral or intravenous. In severe cases, in addition to the previous treatment, the patient will need admission to the intensive care unit, tracheostomy with mechanical ventilation for 3 to 4 weeks اللي هي الفترة duration of spasm. Okay, 3 to 4 weeks. قلنا يصير recurrent spasm, each spasm for a few minutes, and it will recur within the first 3 to 4 weeks. ليش نعمل tracheostomy ما نخلي المريض على endotracheal tube؟ لأن شافوا بأن endotracheal tube is a stimulus for the development of spasm. Magnesium sulfate as intravenous infusion to control spasm and autonomic dysfunction. And lastly, diazepam and as intravenous infusion, continuous infusion. Unlike in mild cases, we can give here oral intravenous at a different interval. Here, in severe cases, we should give an infusion. The last subject is necrotizing fasciitis. It's commonly known as a flesh-eating disease. It's a severe infection that spreads rapidly and results in death of tissue. The symptoms include red or purple skin in the affected area, severe pain, fever and vomiting. The site of predilection of necrotizing fasciitis is the limbs and perineum. Usually the infection enters the body through a break in the skin, as in with a wound or cut or burn. What are the risk factors for development of necrotizing fasciitis? هاي كلش مهمة. The first of all is immunodeficiency, like in diabetes or cancer, obesity, alcoholism, intravenous drug use, and lastly, peripheral artery disease. The diagnosis need high index of suspicion, and when we suspect necrotizing fasciitis clinically, imaging study like X-ray can help in diagnosis. If it caused by gas from microorganism, we may see gas under the skin in the subcutaneous area, but it is not fixed as in a case of gas gangrene. The treatment usually by extensive surgical debridement of the affected area with aggressive antibiotic coverage. واضحة لي هون يعني؟ طلاب؟ منو يجاوبني؟ زكريا، محمد، يونس.
واضح دكتور.
إذا جاوبوا يا جماعة جاوبوا، أنا عبالي أحكي وصوت ما يوصلكم.
لا دكتور، احنا هم نحسب إذا يكون أحد عنده سؤال أو شيء منطقي
اوكي. هي طبعا يعني سيرجيكال انفكشن موضوع كلش طويل، لكن اختصرتوه قدر الامكان حتى يكون شويه سهل الفهم بالنسبه لكم. فهذا كلش بريف حتى يظل ببالكم. خوش عيني. وصلنا للنقطه الاخيره من المحاضره مالنا، هي how to prevent infection. We have two means. The first is a preoperative preparation، واللي هي involved person بيها هو البيشنت والستاف وكذلك الثياتر. والنقطة الثانية هو عندنا ال preoperative preparation. Regarding preoperative preparation to avoid or to prevent infection, first of all we should correct the predisposing factors and improve nutrition of the patients. مثلا إذا كان عندنا uncontrolled diabetes نعالجه. heavy smoker drinker نحاول نوقف الدرينكينج والسموكينج. Second, short preoperative stay, which is very important to reduce the infection, which is acquiring like for example methicillin resistance staph aureus infection. Third, avoid surgery in active infection and treat them first. يعني as for example جانا مريض cholecystitis severe وعملنا امبايما، اوكي، فهوني we should control infection before doing surgery. Hand wash or alcohol based gel before dealing with the patient. Regarding the staff, staff with a focus of infection or wound injury should not enter the theater. ياخذ إجازة ويقعد بالبيت يتعالج. Shaving or electrical clipping of hair just before surgery، ما يجي لكن حلقة قبل يوم يومين بعدين مع عرضة انه يصير عنده infection. Use of prophylactic antibiotic pre-op and finally surveillance of the operative room environment. نقصد بها laminar flow system and filtered air. هذه measures for sterilization. Regarding operative preparation, short nail for the surgeon and assistant, scrub patient's skin by chlorhexidine or povidone iodine. The number and movement of staff to in and out of theater should be controlled and kept to the minimum. يعني ما يصير شخص ما له شغل يفرفر بالصالات، يعني الأشخاص اللي بالصالة لازم يكون أقل عدد ممكن حتى نعمل control of infection. وهاي النقطة صراحة تحرجنا يعني خلينا نقول نحن دائما نريد نخلي الطلاب يحضرون عمليات، فهاي نقطة تخلينا نحدد عدد الطلاب اللي يحضرون عمليات. الحكي بعدين بالخامس وبالسادس تصلون إن شاء الله. Regular surveillance for quality of sterilization of instruments، يعني دائما نتابع تعقيم ونتابع الأوتوكليف وشرعة تعقيم الأدوات. Periodic immunization of the staff against tetanus and hepatitis, which is very important. Perioperative avoidance of hypothermia and use of auto in recovery for patient طبعا. And finally, the proper surgical skill with a gentle tissue handling, again it's also avoid infection. اكو سؤال لي هون يعني خلصت المحاضرة، يعني بسطوها باللي يقدر علينا بقدر المستطاع علينا، وبالنسبة لكم شوية تكون complicated. اكو سؤال؟